in any community, there's gaps in resources and barriers to finding solutions to the SDOH barriers, those social determinants of health. Say we have one of our members that we're working with and they've lost their home, they're homeless, but they're in the process of getting a new apartment, which happens often. Partnering with iHub, they have so many resources that can help them get some furniture, pay their rent, pay their utilities, get them on their feet, get them some supplies just for to keep their head warm through the winter. Those things are so important.
And sometimes connecting them to the care is the best part, right? Like if you're like, hey, I know this provider group or I know iHub and they can get you furniture, and the member's like, what? There's no way. And we're like, we did it. We're magic workers, but just they don't even believe that we did it. So even just connecting them to the resources is big.
Like those little things, they matter and they go a long way.
Definitely. Things that we take for granted, if I want something to eat, I open my fridge to fresh food. I don't have to move my money around monthly. I don't have to not pay my electric bill so that I can afford food. And watching, especially in the pediatric population, families operate that way, and it just creates bigger gaps for them. So what looked like not enough money for groceries in 3 months has grown, and now they are unhealthy and they're sick. And why? And so seeing those gaps being closed as soon as they're identified, and watching the member not even notice that we just changed the trajectory of their 6 months is huge. Like we helped you close that gap. And so now 6 months from now, you're not going to be sick. You're not going to be at the doctor. You're not, and that's been very touching for me to watch that happen.